So clinical trials in the UK are again more concentrated towards the teaching hospitals, which I think is not correct way of putting the clinical trials to the general public and to the patients. So more and more clinical trials, the drug companies should come to the district general hospital also, where these clinical trials can be run. I'm the clinical trial lead for LGT, and we have got few trials, but not as many as we could have actually managed and we could have actually started to benefit the patients. So we need to be offered more clinical trials. We have got a very good and large, robust, very efficient team from the nursing point of view, and at the same time we have got a large clinical team to look after the clinical trial. I know the clinical trial is a massive amount of work. We have to be very cautious, and we have to have frequent visits of the patients, and we need to examine these patients very frequently. But we are fully prepared for that. And I would like to mention that I have got a 93 years old gentleman who is multiple myeloma, suffering from multiple myeloma, and 3 years down the line he's doing very, very well on clinical trial. He's on fitness trial, and you wouldn't imagine that he comes to the clinic without stick, without any help, and his outcome has improved massively at the age of 92. You can imagine at this age people start thinking, oh, why we need to actually leave alone the clinical trial, but this patient has massively improved. And we have another patient who had AML. He's 65. He was on the the Victor trial for AML for the NPM positive patient, and 3 years down the line this patient, without the need of transplantation, only with chemotherapy, now he's actually doing the world tour, he's doing cruises, he's fit as a fiddle at the moment, and he can't believe that his life has changed so much in the last 3 years just because of the clinical trial. So I would make my center even more research centric and invite more patients, and also at the same time request my colleagues and encourage them to become more research active in the center.